Another day, another story. 1. The nurse is planning activities for a patient diagnosed with bipolar disorder with aggressive social behavior. Which activity would be the most appropriate? A. Chess. B. Writing. C. Board games. D. Group exercise. Answer, B. Rationale. Solitary activities that requires a short attention span with mild physical exertion are the most appropriate activities for the patient with aggressive behavior. Writing, journaling, talks with the staff, and finger painting are activities that minimize stimuli and provide a constructive release for tension. The remaining options have a competitive element to them or are group activities and need to be avoided because they can stimulate aggression and increase psychomotor activity. 2. The nurse is caring for a patient diagnosed with paranoid personality disorder who is experiencing disturbed thought processes. In formulating a nursing plan care, which best intervention would the nurse include? A. Increase socialization of the patient with peers. B. Avoid using a whisper voice in front of the patient. C. Begin to educate the patient about social supports in the community. D. Have the patient sign a release of information to appropriate parties for assessment purposes. Answer, B. Rationale. Disturbed thought process related to paranoid personality disorder is the patient's problem, and the plan of care must address this problem. The patient is distrustful and suspicious of others. The members of the healthcare team need to establish rapport and trust with the patient. Laughing or whispering in front of the patient would be counterproductive. The remaining options ask the patient to trust on multitude of levels. These options that are too intrusive for a patient with this disorders. 3. The nurse is caring for a patient just admitted to the mental health unit and diagnosed with catatonic stupor. The patient is lying on bed in a fetal position. Which is most appropriate nursing intervention? A. Ask direct questions to encourage talking. B. Leave the patient alone so as to minimize external stimuli. C. Sit beside the patient in silence with simple open-ended question. D. Take the patient into dayroom with other patients to provide stimulation. Answer, C. Rationale. Patients who are withdrawn may be immobile and mute and may require consistent, repeated approaches. Communication with withdrawn patients requires much patience from the nurse. Intervention include the establishment of personal contact. The nurse facilitates communications with the patient by sitting in silence, asking simple open-ended questions rather than direct question, and pausing to provide opportunities for the patient respond. Although overstimulation is not appropriate, there is no therapeutic value in ignoring the patient. The patient's safety is not the responsibility of the patient.
4. The nurse is preparing a patient with schizophrenia and a history of command hallucinations for discharge by providing instructions on interventions for managing hallucinations and anxiety. Which statement in response to use instructions suggests to the nurse that the patient has a need for additional information? A. My medications will help my anxious feelings. B. I'll go to support group and talk about what I am feeling. C. When I have command hallucinations, I'll call a friend for help. D. I need to get enough sleep and eat well to help prevent feeling anxious. Answer, C. Rationale. The risk of impulsive and aggressive behavior may increase if the patient is receiving command hallucinations to harm self or others. If the patient experiencing a hallucination, the nurse or health counselor, not a friend, would be contacted to discuss whether the patient has an intention for self-harm or to others. Talking about auditory hallucinations can interfere with subvocal muscular activity associated with hallucination. The patient's statements and the remaining options will aid in wellness but are not specific interventions of hallucinations, if they occur. 5. The nurse observes that a patient is pacing, agitated, and presenting aggressive gestures. The patient's speech pattern is rapid, and affect is belligerent. Based on these observations, which is the nurse's immediate priority care? A. Provide safety for the patient and other patient on the unit. B. Provide the patients on the unit with a sense of comfort and safety. C. Assist the staff in caring for the patient in controlled environment. D. Offer the patient a less stimulating area in which to calm down and gain control. Answer, A. Rationale: safety of the patient and other patients is the immediate priority. The correct option is the only one that addresses the safety needs of the patient as well as those of the other patients. 6. Which nursing interventions are appropriate for a hospitalized patient with mania who is exhibiting manipulative behavior? Select all that apply. A. Communicate expected behaviors to the patient. B. Ensure that the patient knows that they are not in charge of the nursing unit. C. Assist patient in identifying ways of setting limits on personal behaviors. D. Follow through about the consequences of behavior in non-punitive manner. E. Force rules by informing the patient that they will not be allowed to attend therapy groups. F. Have the patient state the consequences for behaving in ways that are viewed as unacceptable. Answer: A, C, D, F. Rationale: interventions for dealing with a patient exhibiting manipulative behavior include setting clear, consistent, and enforceable limits on manipulative behaviors, being clear with the patient regarding the consequences of exceeding the limits set, following through with the consequences in non-punitive manner. Assisting the patient identifying a means of setting limits on personal behaviors. Ensuring that the patient knows that they are not in charge of the nursing unit and appropriate power struggle need to be avoided. Enforcing rules by informing the patient that they will not be allowed to attend therapy groups is a violation of patient's right. 7. A manic patient begins to make sexual advances toward visitors in the day room. When the nurse firmly states that this is inappropriate and will not be allowed, the patient becomes verbally abusive and threatens physical violence to the nurse. Based on the analysis of this situation, which intervention would the nurse implement? A. Place the patient in seclusion for 30 minutes. B. Tell the patient that the behavior is inappropriate. C. Escort the patient to their room, with the assistance of other staff. D. Tell the patient that their telephone privileges are revoked for 24 hours. Answer: C. Rationale: the patient is at risk for injury to self and others and should be escorted out of the day room. Seclusion is premature in this situation. Telling the patient that the behavior is inappropriate has already attempted by the nurse. Denying privileges may increase the agitation that already exists in this patient. 8. A patient is admitted to medical nursing unit with diagnosis of acute blindness after being involved in a hit-and-run accident. When diagnostic testing cannot identify any organic reason why this patient cannot see, a mental health consult is prescribed. The nurse plans care based on which mental health condition? A. Psychosis. B. Repression. C. Conversion disorder. D. Dissociative disorder. Answer: C. Rationale: a conversion disorder is alteration or loss of physical function that cannot be explained by any unknown pathophysiological mechanism. A conversion disorder is thought to be an expression of a psychological need or conflict. In this situation, the patient witnessed an accident that was psychologically painful that the patient became blind. Psychosis is a state in which a person's mental capacity to recognize reality, communicate, and relate to others is impaired, interfering with the person's ability to deal with life's demand. Repression is a coping mechanism in which unacceptable feelings are kept out of awareness. A dissociative disorder is a disturbance or alteration in the normally integrative functions of identity, memory, or consciousness. 9. The nurse is conducting a group therapy session. During the session, a patient diagnosed with mania consistently disrupts the group's interactions. Which intervention would the nurse initially implement? A. Setting limits on the patient's behavior. B. Asking the patient to leave the group session. C. Asking another nurse to escort the patient out of the group session. D. Telling the patient that they will not be able to attend any future group sessions. Answer: A. Rationale: manic patient may be talkative and can dominate group meetings or therapy session by their excessive talking. If this occurs, the nurse initially would set a limits on the patient's behavior. Initially, asking patient to leave the session or asking another person to escort the patient out of the session is inappropriate. This may agitate the patient and escalate the patient's behavior further. Barring the patient from group sessions is also an inappropriate action because it violates the patient's right to receive treatment and is threatening action. 10. A patient is unwilling to go to church because the ex-spouse goes there and the patient feels that the ex-spouse will laugh at the patient. Because of this hypersensitivity to reaction from the spouse, the patient remains homebound. The home care nurse develops a plan of care that addresses with personality disorder. A. Avoidant. B. Borderline. C. Schizotypal. D. Obsessive-compulsive. Answer: A. Rationale: the avoidant personality disorder is characterized by social withdrawal and extreme sensitivity to potential rejection. The person retreats to social isolation. Borderline personality disorder is characterized by unstable mood and self-image and impulsive and unpredictable behavior. Schizotypal personality disorder is characterized by display of abnormal thoughts, perceptions, speech, and behavior. Obsessive-compulsive personality disorder is characterized by perfectionism, the need to control others, and devotion to work. 11. When planning the discharge of a patient with chronic anxiety, which is the most appropriate maintenance goal? A. Suppressing feelings of anxiety. B. Identifying anxiety-producing situations. C. Continuing contact with crisis counselor. D. Eliminating all anxiety from daily situations. Answer: B. Rationale: recognizing situations that produce anxiety allows the patient to prepare to cope with anxiety or avoid a specific stimulus. Counselor will not be available for all anxiety-producing situations, and this option does not encourage the development of internal strengths. Suppressing feelings will not resolve anxiety. Elimination of all anxiety from life is impossible. 12. A patient admitted to the mental health unit with a diagnosis of depression. The nurse would develop a plan of care for the patient that includes which intervention? A. Encouraging quiet reading and writing for the first few days. B. Identification of physical activities that will provide exercise. C. No socialization activities until the patient asks to participate in milieu. D. A structured program of activities in which the patient can participate. Answer: D. Rationale: a patient with depression often is withdrawn while experiencing difficulty concentrating, loss of interest or pleasure, low energy, fatigue, and feeling of worthlessness and poor self-esteem. The plan of care needs to provide successful experiences in a stimulating yet structured environment. The remaining options are either too restrictive, often little or no structure and stimulation. 13. A patient diagnosed with delirium becomes disoriented and confused at night. Which intervention would the nurse implement initially? A. Move the patient next to the nurse's station. B. Use an indirect light source and turn off the television. C. Keep the television and soft light on during the night. D. Play soft music during night, and maintain a well-lit room. Answer: B. Rationale: provision of a consistent daily routine and low-stimulating environment is important when a patient is disoriented. Noise, including radio, television, may add to the confusion and disorientation. Moving the patient next to the nurse's station may become necessary but is not the initial action. 14. A patient say to the nurse, "The federal guards were sent to kill me." Which is the best response by the nurse to the patient's concern? A. I don't believe this is true. B. The guards are not out to kill you. C. Do you feel afraid that people are trying to hurt you? D. What makes you think the guards were sent to hurt you? Answer: C. Rationale: it is most therapeutic for the nurse to emphasize with the patient's experience. The remaining options lack this connection with the patient. Disagreeing with the delusions may make the patient more defensive, and the patient may cling to the delusion even more. Encouraging discussion regarding the delusion is inappropriate. 15. The nurse is working with patient who, despite making a heroic effort, was unable to rescue a neighbor trapped in a house fire. Which patient-focused action would the nurse plan to engage in during the working phase of nurse-patient relationship? A. Exploring the patient's ability to function. B. Exploring the patient's potential for self-harm. C. Inquiring about the patient's perception or appraisal of why the rescue was unsuccessful. D. Inquiring about and examining the patient's feelings for any that may block adaptive coping. Answer: D. Rationale: the patient must first deal with feelings and negative responses before the patient can work through the meaning of the crisis. The correct option pertains directly to the patient's feelings and is patient-focused. The remaining options do not directly focus on or address the patient's feelings. Thanks for watching.